Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the good pharmacy practices. Membership in an association for advancement of pharmacy profession as a part of continuing pharmacy education program. Maintenance of patient records for the period of 5 years from the date of commencement of the treatment. Computerized medical record for quick retrieval. Exposure of the unethical conduct, expose incompetence or corruptions, exposed dishonest or the unethical conduct, highest quality assurance in patient, help in the safeguarding the profession against those who are deficient in moral characters or education. Next is the renewal of registration. For renewal of registration, the pharmacist shall attend the minimum two refresher courses in pharmacy of minimum 1 day duration each in a span of 5 years organized by the Pharmacy Council of India, State Pharmacy Council, Central Government, State Government and professional bodies recognized by the Council. Pharmaceutical care. No person other than a registered pharmacist shall compound, prepare, mix, dispenser, or the supply for the purpose of promoting therapeutic appropriateness by identify first overutilization or underutilization. Second is the therapeutic duplication. Third is the drug release interactions, and fourth is the incorrect drug dosage or duration of drug treatment, and next is the drug allergy interactions, correlation of availability of the drugs, clinical abuse, misuse. Upon recognitions of above step, the registered pharmacist should be appropriate step to avoid or resolve the problem. So in today's class we discuss about the good pharmacy practice. Thank you for watching.